Suboccipitals, where are they?
Below the occiput.
How far down do they go?
To C2.
Okay, so we have some from C0, so the occiput, to C1. We have some from C1 to C2, so just be aware of that. So you're going to be looking in this region. This you're going to do supine, but you're going to find C2, and you're going to palpate up to the occiput, and you're going to go right off the side of the spinous process, and you're going to be looking for different muscles. You can know you're in the right spot because you can turn your head slightly towards me. Good. You could turn away. Good. And they should poke into your hands. Little muscles deep in this little soft spot off the side of the spinous process. You could do a gentle poke, look up towards where it says palpation, and then relax. Do it again. Good. Relax. That gets a little bit of the suboccipitals too, because it's upper cervical extension. They're in that region. When you have them passively in supine, you can palpate the different angles, because you're going to have some going from C1 to C2, some up and down like this, so you can look at the different fascicles. Oh yeah. SCM, turn your head to the left. Good. Turn your head to the right. Good. You could trace the SCM. Oh yeah. No, not yet. Stay that way. Scalenes go sideways, so good. You could just find the scalenes and work your way down the neck, down to the rib. Levator scap, you can either stretch it out, relax, or you could turn your head to the right. Good. And you want to be able to palpate from the, what's this? Superior angle of the scap up to the sides of transverse processes 1 through 4. Okay. Upper trap. There. And levator disc, SCM, face that on. You guys know what SCM is. Okay. We're up top. I want you to flex your head forward. Good. Yep, good. Relax. We could work our way down to the clavicle and just back up. You can resist flexion, you can resist rotation. Turn your head to the left. Turn your head to the left. Good. Good. Head straight. Turn your head straight. You should see muscles poking out on the sides. So just trace them down. SCM, you really, I guess I don't always look at SCM as a culprit for spasming as much as it's your deep cervical neck flexors, if they're inhibited or they lack strength, your SCM takes over. So you just have to be aware that when you're retraining them, make sure those muscles stay quiet. So it's nice to be able to show patients that you can palpate them. You feel that muscle bulk? Yes, great. Whenever you do anything like this, you should not feel anything so that they know what not to do. Any questions on those muscles? All right. So you're going to practice that. Just have them in prone, supine, sitting, whatever's easiest for you. When it comes to transverse processes and whatnot, spinous processes, lay down on your stomach. It's easiest to find them in this position. So just have them in prone. Put your forehead on your forearms. Keep their head in a neutral position. That way you can find the spinous processes, and then you could work the muscle off to the side. You should find little bony ridges on the side. That's where your transverse processes are going to be. Sound good? Mm-hmm. Okay. Let's find those things. Follow us.